Hello, I'm delighted to be able to present at the Applied Research Collaboration Kent, Surrey and Sussex Research Week. My name is Julie MacInnes and I'm a researcher at the Centre for Health Services Studies at the University of Kent, and I'm lead for the CAVEAT project. So CAVEAT is a community and voluntary organisation evaluation toolkit, and the team is a group of researchers at the University of Kent, Brighton and Sussex Medical School, the University of Surrey and ARC KSS. So first, a little bit of background to the study. So our previous research, which was called Community-Based Volunteering in Response to COVID-19, the COV-VOL study, highlighted the important contribution of voluntary community and social enterprise organisations in supporting older people shielding at home during the pandemic. We identified a need for VCSE organisations to demonstrate the scope and the nature of their work they do, that the services they provide are of a high standard and meet the needs of the people they support. However, we found that many organisations did not routinely collect this data that would enable them to evidence their activities and their impact. So that led us to the CAVEAT project, the aim of which was to develop and test a set of guidelines or resources that voluntary organisations could use to collect data and information to demonstrate the value, activity and impact of the services they provide for older people in their communities. So this diagram is a bit of an overview of the project. So CAVEAT was conducted over 4 phases or work packages. We conducted an evidence review. We carried out a scope and of practice. We then developed the prototype toolkit. And we then tested it with organisations, VCSE organisations. Dissemination and implementation were also critical parts of the study. So also on this slide, you can see that public and patient involvement and also engagement of key stakeholders was also what we consider to be a key factor for success. So first, the evidence review. In this phase, the purpose was to identify published, individual and organisation level outcomes of VCSE organisations for older people. And this review was conducted in 3 stages. We carried out a literature review, which was of published and so-called grey literature. We carried out a review of this evidence, and from that we identified specific outcomes. And then we agreed these outcomes and these findings that we were going to use and take forward into subsequent phases. So from this review, we developed a basic typology or kind of classification or list of the range of outcomes that were reported by VCSE organisations. And this informed the development of the interview schedules, which we were going to use in phase 2. It's probably worth pausing here just to say what we mean by outcomes. And for us, we mean the benefits that result from a service or organisation in terms of supporting older people at home. In phase 2, the purpose was to identify which of those outcomes were being measured in practice and what data was being collected by VCSE organisations to demonstrate the activities and impact of the services. And we did this using 2 methods. So we recognised that a lot of the outcomes that would be relevant to the toolkit would not be in published academic journals, hence why it was important to carry out other methods of finding out what was going on out there. So we conducted interviews with VCSE leads and service commissioners across the region, across Kent, Surrey and Sussex. We also sourced and analysed documents. So we requested organisational documents relating to policy and practice, and also commissioning frameworks from our interviewees. So from the work that we did in phase 1 and phase 2, we then, before we moved on, we kind of sort of paused and looked at where we were and pulled together some key findings. And so from phase 1 and phase 2, we found that client outcomes or outcomes for older people were around access to information and advice, client choice and independence, safety, social inclusion, and well-being, whether that's health or emotional well-being. And data describing client journeys or narratives was particularly powerful, especially when presented alongside quantitative metrics like questionnaires or output data such as the number of clients accessing services. And we found that collaboration between VCSE organisations, particularly around working together to share learning and develop joint funding bids, was particularly an ambition of service commissioners. So phase 3 was the development of Caveat. So using the outcomes we identified in the previous phases, we used these as a starting point, and we conducted an online workshop with stakeholders to refine the outcomes and build a consensus around what outcomes were to be included in the toolkit. And 14 people took part in the workshop, including leaders of VCSE organisations, health and social care practitioners, commissioners, funders, and also public members. And from this, we developed a prototype toolkit, which ended up being an interactive web-based resource. So phase 4 was the testing of Caveat, and this really was one of the most crucial parts of the study. We identified and selected 4 VCSE organisations who'd been working with us around the development of Caveat, and we selected them to be our case sites to test the toolkit in the real world, specifically whether the outcomes and their measurement were fit for purpose and that the data could be feasibly collected and presented in a meaningful way. And we selected case studies from across the region, and we were also keen to choose organisations of different sizes and structures. So our 4 case sites were Age UK South Kent Coast, which is a nationally affiliated organisation, Community Angels, which is a neighbourhood faith group in Guildford, Wellsbourne Healthcare, which is a community interest company, and they're based in primary care in Brighton, and also Switchboard, which is a local established VCSE organisation, also in Brighton. Well, first of all, we introduced the prototype toolkit to our case studies, and we kept in touch with them over a period of weeks while they were testing the toolkit to make sure and troubleshoot if they had any technical issues. And finally, we sought structured feedback using a cognitive interview technique, particularly around the design, the navigation, and the content of the toolkit. From that, we took the feedback, we went back and we've revised the website, the toolkit, so that it's now at the point at which it's due to launch. So just to give you some sort of key features of the toolkit before I go on to show you some screenshots of what it actually looks like, is that it was important to us that the toolkit was free to use. This was all for us, this is about capacity building in the sector so that people could demonstrate impact without any additional kind of expenditure where possible. The toolkit has a how-to guide and information of what we mean by outputs, outcomes, and impact, so the sort of nuts and bolts bit, if you like. And there's also an important section that we've called knowledge base. And this has examples of, so for example, quantitative examples. So, you know, what are surveys? How do you develop a good survey? Qualitative examples. So what are case studies? And also some hints and tips on how to write a good case study and how to conduct and analyze interviews and focus groups with examples and templates. So this slide, if you can see it, is just a screenshot of the page that talks about interviews. So as well as an explanation about what interviews are, it also includes some advantages and disadvantages of this data collection method, and also some hopefully useful links to other resources. And we've done the same for other areas of the knowledge base. So, you know, how to write a good survey, for example, are some of the pitfalls and tips, if you like. But we think the star of the Caveat toolkit is this outcomes model. So this consists of 4 domains. So as you can see them here on the outer circle, so this is physical and health, social and interpersonal, emotional, psychological, and economic. And within each of these domains, outcomes apply at different levels. So outcomes that we've called relating to people, volunteers, organisation, and systems. So again, another screenshot. So clicking on each of those domains or levels takes you to a list of outcomes. And if you remember from what I said earlier, that these were the outcomes that we discussed and defined and agreed with our stakeholders at that consensus building workshop event. So we've mentioned these earlier. These, for example, are the outcomes, the final 6 outcomes that we developed, which were around emotional well-being, and particularly those outcomes that applied to clients or service users or people who are using the service. So this is another screenshot. So by clicking on each of the individual outcomes, takes you to suggested ways in which you could measure those outcomes. And you can see here from this example that these are often a list of pre-tested or what we call validated tools, such as questionnaires, but also links back to guidance in the website, which is around what makes a good case study, for example. So here you can see for clients experiencing happiness or joy, there is a few validated tools that we've suggested and tested, but also a case study might be a good way in which you demonstrate this outcome. And hopefully you can see as well these little icons next to the validated questionnaires. And these tell you a little bit about the questionnaire. So we've done a little bit of road testing, if you like. So it tells you whether the questionnaire is free to use, also how complex it is. Some questionnaires are highly complex, requiring quite a lot of skills. So we've tried to indicate that too. We've also tried to indicate whether permissions are needed or whether you just need to cite the authors of those questionnaires. So that, in essence, is the toolkit. But just to highlight, there is another key feature in that it allows users or voluntary organisations accessing the toolkit to select the outcomes that are relevant to their organisation or service and download these as a PDF in order to develop their own bespoke outcomes framework. So we've given guidance, and we're hoping that organisations will click on the outcomes that speak to their befriending service, for example, to build their own outcomes framework. So hopefully that has given you a little bit of insight into how the Caveat Toolkit was developed, but also how it can be used in practice. In terms of implementation, our vision is that the Caveat Toolkit will be user-friendly and of value to the VCSE sector, service commissioners, and others. And to make this vision a reality, we were committed throughout to engaging with and listening to a range of people, including VCSE organisation leads, service commissioners, community health and social care practitioners, the volunteers themselves, public members, and also the older people who use voluntary services. And we've worked with ARC KSS, the implementation lead for social care, to ensure that our experiences and the learning that we've developed have been disseminated throughout at each stage of the project. ARC KSS, as part of this presentation, also asked us if we could provide some sort of hints and tips, some do's and don'ts around how to engage stakeholders. External stakeholders, external to the project, were absolutely crucial to the development of this project. And so from that, we've put together what we think are some of the do's and don'ts and hints and tips. So first of all, do develop a plan for stakeholder engagement, but be prepared for this to change over time, particularly the who you want to engage, how you want to engage them, when you're going to engage them, and for what purpose. And don't underestimate the importance of taking time to build and maintain relationships with those stakeholders. And we would suggest that you start identifying and engaging with people very early on in projects. Do use existing contacts, so people you may have worked with in the past, and also networks that you potentially have access to. Do ask contacts you already have to make introductions. So often that's better than a sort of unsolicited email. Do have a clear ask. What are you asking your stakeholders to do? Are they being asked to be part of an advisory group? Are they asked to give you feedback on documentation? Are they going to be part of your sort of workshops to develop, in our case, the Caveat outcomes? And put yourself in the position of those who you're trying to engage with. So think about what's in it for them. Commissioners, for example, might want a very different message to older people who are using the services, for example. So think about your sales pitch and how you adapt that to different stakeholders. And finally, we would say be bold. Don't be afraid to approach key stakeholders. You may think they're, very important people and they would not be at all interested in your project. But if you don't ask, you don't get. So it's worth a try. So aim high and don't be afraid to approach people. So finally, do get in touch. We'd love to hear from you. Visit our project website, and that's on the screen there as well. And do sign up for our online launch event on the 28th of June.
And if you want to do that, please contact Rebecca Sharp.
And she'll add you to the list. And at that launch event, we are going to show you the Caveat Toolkit live, as it were, to show you some of the functionality and how it can be useful. And of course, if you want to know more or have any questions or queries, then please do contact me, Julie MacInnes, the project lead. Thank you for listening.